Thank you, Boyd. Now, hopefully you can all see my screen.
Yep, that's good.
All right, good. Yeah, so as Boyd mentioned, I'm based here at the University of Auckland, and I've been helping with the INFORMAS Secretariat. Now, as you probably know, INFORMAS is structured by modules representing different domains of the food environment. And I'll just be giving a brief high-level update distilled from the presentations, the module update presentations that were covered in some of the previous sessions. All right, so for the following 6 modules, I'll briefly talk about who is now leading the module, where there has been uptake globally, methodological innovations, if any, and future directions for the module. And so the other module updates will be covered in the technical discussions that follow. Starting with food composition, the monitoring of nutrient composition of the food supply provides valuable information for consumers to help guide their dietary decisions, but also guidance to inform government nutrition policy, for example, with sodium targets, identifying food categories that contribute most to dietary intake, and then setting appropriate targets. Then monitoring and evaluation of nutrient content, including making the case for any voluntary schemes to become mandatory, if that's applicable. It can also drive companies to act by reformulation, by naming and shaming in terms of performance and compliance. So for example, ranking companies by proportion of their products meeting reformulation targets. So previously, INFORMAS modules were led by one person, but the network has moved in the past year towards a distributed leadership module with teams working together to progress the modules and global uptake. So the INFORMAS module team on food composition is now led by Jason Wu at the George Institute for Global Health in Australia. And the module leadership team here is not yet finalized, but it will likely include the following INFORMAS researchers working in food composition research. At the moment, the team is still fairly centralized, especially within the George Institute. So this group will ideally include more researchers from other regions, especially Latin America, Asia, and Africa. In terms of global uptake, as of April of this year, from our self-reported surveys of INFORMAS activity, there were studies based on INFORMAS protocols completed and or published in 13 countries, including those that you see in blue on this map. There was also research in the planning phase or underway in 8 countries. And yeah, because this is self-reported, we may not have captured all of it. So if I have missed anyone, please do let us know. So this research can be done by research teams going into food outlets, looking at each food item and then recording the ingredients on the label, but this is rather time and resource intensive. So increasingly, data is collected by crowdsourcing through consumer-facing apps that help to collect data in real time, while also providing suggestions to consumers of healthier options while they shop. And this module also links up well with many of the other INFORMAS modules, for example, food labeling and comparing nutrient composition with information on labels, food retail, looking at how healthy are the products on offer, the private sector, specifically the BIA obesity tool, and looking at how companies are doing in terms of reformulation and offering healthier products. And you can also merge this food composition with household food purchasing data, which helps to give an indication of population diet quality. In the future, this module, a lot of researchers will be moving from in-store collection of data to web scraping to save time and costs. So for instance, using nutrient information provided on retailer web pages. There are, however, some challenges to this. There's obviously, in terms of the availability and quality of information on retailers' websites, but there's also a question of legality in some jurisdictions. And companies who don't want their websites scraped have been changing their web pages to avoid their data being picked up by the tools. So those are some of the issues that have been discussed in the module sessions to date by the researchers engaged in this. So moving on to food labeling. This module was developed initially to monitor the nature and extent of health-related labeling on food and beverages in different countries and over time. So this includes, for example, nutrient declarations, percentage guideline daily amounts, health and nutrient content claims, front of pack interpretive nutrition labeling, and child-directed marketing on food packaging. At present, the module leadership team has not yet been established. There have been studies based on INFORMAS protocols completed and or published in 8 countries so far, including Africa, New Zealand, Mexico, Costa Rica, Chile, Brazil, India, and Canada. And there was research in the planning phase or underway in 10 other countries. And a lot of this research looks at labeling uptake, how different labeling regulations are performing, and including making the case for voluntary schemes to become mandatory. So there actually hasn't been much INFORMAS related research activity reported recently. However, there have been some important developments in global policy implementation, which we'll run through. For nutrient declarations, most countries now have mandatory nutrient panels, but not all of them include all nutrients like sodium. And these aren't particularly useful to guide consumer choice, just because generally literacy of these nutrient information panels is not great, but they are essential for transparency in the food supply. As for recent innovations, there have been requirements to declare trans fats, which aims to incentivize reformulation and removal, and currently more than 15 countries have mandatory trans fat labeling. There have also been some requirements to declare and quantify added or free sugars. So this was adopted in 2016 by the United States and Mexico in 2020, and now the EU and Australia and New Zealand are considering it. We do need robust definitions of added sugars in our ongoing research, as we found there's issues around fruit powders, pastes, and concentrates. For front-of-pack nutrition labeling, now more than 30 countries have a government-endorsed front-of-pack nutrition label, which is increasingly made mandatory, which supports consumer choice and incentivizes reformulation. At least 8 countries now have a mandatory front-of-pack nutrition label. These interpretive labels can take many different forms, and there's significant evidence to support both a warning and spectrum type labels. And the WHO doesn't recommend any specific scheme over another. Different labels work best for achieving specific aims. So for example, guiding consumers towards healthier choices, which might be through a spectrum label, or discouraging consumption of unhealthy choices through warnings. There are some limitations. There's limited real-world research on this. So for example, we have issues comparing voluntary with mandatory schemes. There's often a lot of other things at play in the food environment that it's hard to tease out. For recent innovations here, there's Mexico's front-of-pack nutrition label, including warnings for the presence of sweeteners and caffeine. There's been links between front-of-pack nutrition labels with marketing restrictions, for example, in Chile and Mexico. And several countries require interpretive nutrition labeling on advertising, for example, in Peru. In the European Union, the Nutri-Score has officially been recommended by the government in France, Germany, Belgium, the Netherlands, Luxembourg, Spain, and Switzerland. And France is also considering taxing products at the unhealthy end of the spectrum. There has been ongoing work at the Codex Alimentarius to develop guidelines on front-of-pack nutrition labeling since 2017, which is significant because the Codex guidelines act as international standards. The outcomes expected in 2022 include setting out principles for national policymakers on developing front-of-pack nutrition labeling. The Codex will not recommend any one specific front-of-pack nutrition label system over another, so there's open choice. It will recognize that front-of-pack nutrition labeling can be voluntary or mandatory, which is a big win, and also recommend that front-of-pack nutrition labeling should be government-led, but developed in consultation with other stakeholders, which is also a win because it's consultation and not collaboration, which was a tough fight apparently in these discussions. The Codex is a really important global governance forum for labeling and other food regulations, and it does have a history of strong industry influence. So this is where we really need a stronger public health and consumer voice. Integrating environmental sustainability labeling is a next step, and the UK is leading the way. And finally, for the module leadership team, this module is currently led by Dr. Ali Jones at the George Institute, but we are seeking members, so do get in touch with her or with the INFORMAS Secretariat if you would like to get involved. So in terms of monitoring food prices, there are three INFORMAS approaches to monitoring the cost of food. The first monitors food prices over time, comparing healthy foods and unhealthy foods. The second looks at meals, comparing the cost of common takeaway meals with their healthy homemade counterparts, also including the cost of meal preparation time. So this is useful for certain particular policy questions. The third looks at diets and comparing the cost and affordability of healthy and less healthy current diets. This module has the largest leadership team led by Dr. Sally Mackay in New Zealand and includes researchers from most regions. And as of April of this year, again, self-reported, there were INFORMAS-based studies completed and or published in Brazil, New Zealand, Belgium, India, Mexico, and Argentina. So they're really leading the way. But there was also research in the planning phase or underway in several other countries, which you can see here. So as I mentioned, there are three approaches to this. The first and third are mainly used by INFORMAS researchers. So we'll just outline some of the main tools and methods. So the first involves monitoring food prices over time. And this can involve using a food price index if that's available. For example, looking at the difference between healthy and unhealthy foods and by level of processing. It can use household budget surveys. So for example, taking a random sample of households, the mean prices of food and beverages purchased, and looking at that, for example, between supermarkets and other outlets. A main challenge is that the relative price of healthy and unhealthy foods varies with the method of measurement and units reported. So for example, the cost per 100 calories versus the cost per 100 edible grams versus the cost per average portion will be different for different food groups. And the seasonality also affects the cost. So a snapshot isn't appropriate here. We really do have to look at these trends over time. And the third approach, looking at diets. So this can use a market basket approach, creating one healthy and one unhealthy or current diet based on national dietary recommendations, and then nutrition surveys of frequently consumed foods. So you collect the food prices and then calculate the diet cost. And this has been done in Australia and New Zealand. There's also a diet cost program and tool. And this models multiple combinations of common foods to provide several diets that meet certain criteria. So again, current or typical diets versus healthy diets based on national dietary guidelines, for example. And it provides a range of diet costs. And so this has been done in New Zealand and Mexico. You can also use a household expenditure survey and create diets from these surveys and convert them for household members. And this was recently done in Argentina, where they analyze the cost per grams, cost per kilocalories, and they use linear programming to do this. So this approach is great to look at affordability. You can look at this for different population groups, for example, by income level, by where they live, and by ethnicity. And this approach also helps to look at the feasibility of following different dietary advice and other new guidelines, for example, for sustainability. Future directions for this module also include data scraping, for example, from supermarkets, and crowdsourcing or using citizen scientists. Several INFORMAS teams are collaborating to incorporate measures of environmental sustainability into analyses of the cost of foods and diets. And there are pilot studies funded by Canada's International Development Research Centre in Mexico, Brazil, and Argentina. The food retail module monitors the availability of healthy and unhealthy foods and non-alcoholic beverages in communities and within retail outlets. And to date, this has been focused mainly on supermarkets. And it can include some of the following measures. So the density of healthy and unhealthy food outlets, the proximity of healthy and unhealthy food outlets to homes or schools, and then the availability of unhealthy and healthy foods in store. And this monitoring data can allow us to compare retail environments over time and across countries, to assess compliance with local policies, guidelines, or codes of practice, and then to also look at the changes in retail environments and their impacts on outcomes like obesity. So the new leadership team for this module reflects a variety of expertise in terms of types of retail environments. For example, increasingly looking at the informal sector and different contextual knowledge of the food environment in different regions. And as of this year, retail studies based on the INFORMAS protocols had been completed and or published in 6 countries, with Argentina being the most recent paper, and these do mainly focus on supermarkets. But research was in the planning phase or underway in about 25 other countries. So you can see from this map here, there's quite a few underway in Asia, and then there were also several in the planning phase in Africa. And these are a few of the future directions identified by the leadership team. So because there's only currently 1 protocol and it's for monitoring supermarkets, the team does plan to update this, so including practical advice on getting permission from stores to access and then how to implement the measures in store and how to analyze the data, but also expanding the protocols to cover online, convenience, and informal retail outlets, and also potentially using consumer purchasing data sets to make this easier. There's potential to include sustainability dimensions, for example, monitoring the use of plastic bags, food packaging, and food waste. And they're also looking into opportunities to bridge with other INFORMAS modules to streamline data collection overall, because as with many modules, there's quite a lot of overlap between them. They've also discussed connecting with retail food environment intervention researchers, which are typically more separate or siloed from those doing this type of monitoring. So moving on to population diet quality. This module monitors and benchmarks the quality of population diets over time and between countries. And the minimal approach looks at national trends of food and energy availability. But the expanded or optimal approach also looks at the dietary share of ultra-processed products as an indicator of energy dense and nutrient poor diets. This module is led by a small team based in Brazil and Canada, including Carlos Monteiro, Jean-Claude Mubarak, and Maria Lara Luzada. And population diets research typically uses food balance sheets, household budget and expenditure surveys, and food intake surveys. However, these can be very expensive and hard to get good data. The team in Brazil is developing an exciting new tool, which is an ultra-processed food screener, to rapidly estimate a score for ultra-processed food intake, identifying low and high consumers to score diet quality. And they're working with other countries, including India, Ecuador, and Senegal, to develop similar tools, as well as developing one in Canada. And so finally, the trade and investment module. This was developed to monitor trade and investment policy at the national level and impacts of trade agreements on national food environments. This covers trade in goods, foreign direct investment, and trade in services, as well as looking at policy space for food environment regulation and governance. So I've included here the conceptual framework from the original INFORMAS paper on the trade module. It shows how trade agreements or their content of trade agreements affects trade in goods, agricultural protections, food processing, food retail, food advertising, and regulatory and policy space. And all of this together influences food environments in terms of food composition, availability, price, and promotion. So far, the full assessments have only been carried out for Fiji and Vanuatu, although one is soon to be underway for Canada, and there's one planned for New Zealand. The module leadership team is co-led by Ashley Schramm, who's based in Australia, and Sharon Friel, who's also in Australia, and they're joined by several other researchers based in Fiji, the UK, New Zealand, and Australia. In the past, the protocol has not been widely taken up, and it was actually not the most user-friendly. So the leadership team is developing a new and improved protocol with enhanced clarity and feasibility, including simplified indicators, clear guidelines, including some advice on data sets. There are also opportunities to incorporate measures of environmental sustainability over the next couple of years. So for example, this looks at changes in trade in goods and food environments in terms of global supply chains, transport, carbon footprint of the food supply, and so on. So that concludes these rapid fire module updates for these 6. I'd like to thank the module leadership coordinators for putting together the content that was used for these updates. And again, the other modules will be covered in the sessions to follow. You'll also soon be able to find the full module updates on the INFORMAS website. Please do get in touch if you have any questions or if you'd like to join any of the leadership teams. And thank you for having me. I hope you enjoy the rest of the day's program.